Hey everyone, welcome back to Bone Graft Academy. Today we're answering a question that confuses a lot of people. What's the difference between a bone graft and a dental implant? It's easy to see why people mix them up. Both procedures are related to replacing missing teeth, both involve the jawbone, and both are done by implant dentists or oral surgeons, but they serve two completely different purposes. Let's start with the bone graft. A bone graft is all about rebuilding or strengthening the jawbone. When a tooth is lost, the bone that used to hold it begins to shrink. That's because bone needs stimulation from chewing pressure to stay strong. Without that pressure, your body starts to resorb the bone over time. A bone graft replaces that missing bone with special graft material. This material can come from a donor, a synthetic source, or even from your own body. It acts as a framework, allowing your natural bone cells to grow into it and form new, solid bone. The result is a thicker, stronger jawbone that can properly support dental implants. Now let's talk about the implant. A dental implant is not the same thing as a graft. The implant is the titanium post that replaces the root of your missing tooth. It's placed into healthy bone, where it fuses with the bone through a process called osseointegration. This fusion creates a stable anchor for a crown, bridge, or full arch restoration. You can think of it like this. The bone graft is the foundation, and the dental implant is the structure built on top of that foundation. Without a strong base, the implant wouldn't last very long. That's why your dentist might recommend a bone graft before an implant, to make sure the bone is dense enough to hold the implant securely for decades. Sometimes both procedures can be done together. For smaller grafts, dentists often place the implant and graft at the same time. For larger grafts or areas with severe bone loss, the graft is usually done first, followed by several months of healing before the implant is placed. A good way to remember it is this. A bone graft builds the land, and the implant builds the house. You need both to create a lasting result. Many patients worry that bone grafting will delay their implants, but in reality, it's what makes implants successful long-term. Skipping the graft when it's needed can lead to implant failure later, which is much harder to fix. Modern bone grafting materials and techniques make the process safe, predictable, and comfortable. With local anesthesia and proper healing time, most patients describe both procedures as far easier than they expected. Understanding how these two treatments work together helps you see the big picture of implant dentistry. It's not just about replacing a missing tooth, it's about restoring the structure and strength beneath it so it lasts a lifetime. If you found this video helpful, make sure to like it, subscribe to Bone Graft Academy, and share it with someone who wants to understand how bone grafts and dental implants really work. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.